much exhausted what we could achieve through skin surface applied technologies. And so what Profound does is it takes the introduction of laser and energy-based technology to the next level. It introduces the radiofrequency energy directly to its target, which is the dermis, via hair-fine needles. The use of needles to introduce laser and light-based and energy-based technology is brilliant, because it will allow for us to bypass the epidermis in order to stimulate maximally collagen, elastin, and hyaluronic acid production. In the course of my clinical studies using the Profound, one area that it is highly effective is at tightening the mandibular line and reducing submental and submandibular laxity. I had been working for close to a decade on the development of this technology. And through randomized blinded controlled trials spanning this last decade, we have finally found that the ideal target temperature in the dermis for maximal collagen generation, elastin generation, hyaluronic acid generation, and correlative wrinkle reduction and laxity reduction is 67 degrees centigrade. One of the major shortcomings of skin surface applied technologies, since they first emerged almost 20 years ago, was the fact that we did not have a 100% response rate. Profound has solved this issue by introducing the radiofrequency energy directly in its target, which is the dermis, bypassing the epidermis and any constraints we have about burning the patient's epidermis. To my knowledge, the Profound is the only device that has had this much consistency, reproducibility, and response rate, with a 100% response rate in a blinded evaluation of randomized digital photographs of patients before and after. It is the only device that I'm aware of that controls for interpatient variability in the ability to achieve a specific target temperature in the dermis. The Profound achieves a specific goal that has up until now not been met by our armamentarium of treatment options. Specifically, when it comes to mandibular laxity and submental laxity, this is not taken care of by injectables alone. The ideal patient for the Profound is someone who has already ruled out the surgical facelift. So I really look at the patients who are in their 40s and their 50s as the ideal candidates for this technology. One important point about the Profound that I'd like to make is the fact that it is age independent. In our multi-center trial, we had patients spanning their 30s all the way to patients nearly 80 years of age. Some of the highest responders in the trial were patients in their late 70s. Unlike skin surface technologies, which fail to work in the patient population over the age of 65, Profound controls for interpatient variability and does work in the over 65 population. Therefore, it is appropriate regardless of age. In addition, if somebody has more severe wrinkles and laxity, the Profound can be repeated. And what I have found in my practices is that we get closer and closer to a surgical facelift result. One thing that is extraordinarily appealing about the Profound as a treatment for patients is that it achieves a natural look. The device works by stimulating your own collagen, your own elastin, and your own hyaluronic acid. It is the only device that I'm aware of that has been shown to stimulate all three of these critical components to a youthful appearance to the skin. And because it's your own skin doing what it's naturally programmed to do, you end up looking like a younger version of yourself. And therefore, it achieves a very natural appearance.